Let us talk about when should you start yoga in pregnancy. And this is the truth which every mother should know. Every mother should know. So hello, I'm Dr. Preeti Trivedi, your sacred pregnancy architect. And the question being that which arises in all of your mind when you are pregnant, that everyone says some movements are important, everyone says there is something which you need to do for your body, but you are actually confused that when should I start yoga during pregnancy. There are so many people talking about how it helps, there are so many people talking about that how it is going to benefit your body, but there is a question: when should I start yoga during pregnancy? This is probably one of the most common questions I received, and so I want to talk on this today. So, yesterday, one mother asked, Doctor, should I wait until third month? Others say, my mother in law told me not to move at all. Some are afraid that yoga may harm the baby, and then there are mothers who think yoga is only about stretching. So today I want to change the way you look at yoga forever. First of all, it is not yoga, it is Yog Sadhana. Because pregnancy yoga is not about touching your toes, it is about touching your baby's life. Your baby does not know whether you perform Trikonasana or you went to Shirshasana. Your baby experienced something much deeper. The baby experiences your breathing, the baby experiences your heartbeat, your emotional chemistry, your nervous system, your hormones, your peace, and this is where Yoga Sadhana begins. Yoga is not an exercise which I consider to be performed during pregnancy. Yoga is a state in which you are. You know, when Maharshi Patanjali defined yoga, he did not mean six pack abs. He said simply, Yogaha Chitta Vritti Nirodhaha. So, when I prepare you all emotionally, I prepare your inner world for your body. Exactly same Acharya Patanjali have said. Yoga is calming of the fluctuations in the mind. So during pregnancy, my dear mothers, the body is changing, hormones are changing, your identity is changing, your relationships are changing, your sleeping patterns change. Sometimes you are fearful. The real battlefield is not the uterus, it is in the mind. So yoga helps create the inner steadiness amidst all these changes. मतलब जहां पर आपके शरीर का बहुत कुछ हिस्सा चेंज हो रहा है, बदल रहा है, मन में एक डर, एक चिंता आ रही है, वहीं पर योग साधना आपको आपके मानसिक तौर पर एक स्टेडीनेस सिखाता है, एक ठहराव सिखाता है. So people say the baby is inside the uterus. It is biologically true, but emotionally, your baby is also living inside your nervous system. So whenever you breathe calmly, your heartbeat slows, stress hormone reduce, your muscles soften, blood flows improves, and your body shifts towards a more relaxed state. This calmer internal environment can support both maternal well-being and healthy pregnancy. So yoga is one of the practices that may help many women achieve this when done safely. So the question arises, when should I start? And my answers really surprises them when I say the day you know you are pregnant. You begin your yoga sadhana. Notice, I didn't say the day you start difficult postures. I said Yog Sadhana. Because yoga is much more than the physical movement. Okay. So when I say that you should start your yoga sadhana from the day you know you are pregnant, that doesn't mean you are going to perform Surya Namaskar, Trikonasana or some Bhujangasana, inverted dog pose. There are the sequences. There are perfect sadhana practices and the sequences for every trimester, for every month, rather, I will say for every week of your pregnancy. So, Patanjali has described eight aspects of your Ashtanga Yoga. Most people know only one, that is the body posture. But pregnancy yoga includes so much more, my dear mothers. Breath awareness, mindfulness, relaxation, meditation, positive intention, gratitude, gentle movement, emotional regulations. So even mothers on complete bed rest can practice several of these safely if approved by their obstetrician. Right? So yoga sadhana in general, you cannot just visualize of you performing so many asana postures. It is a much broader aspect. First trimester, second trimester, third trimester, every time has its own sequence and has its own importance. So during first trimester, this is the trimester of implantation and adaptation. That means what? Your body is getting adapted. There is something new coming inside your body. There is something new happening in your body, right? So this is the trimester of implantation and adaptation. Body is welcoming. Sometimes the body does not welcome. So you have nausea, you have fatigue, you have sleeplessness, emotional ups and downs. It is the time that when your body is getting accommodated to certain changes happening in the body. So you all experience, most of the mothers experience this. This is not the time to push. It is the time to listen. So focus on gentle breathing, relaxation, meditation, prayer, baby bonding. Here, baby bonding does not mean simply you are talking to the body, here to the baby. Here, baby bonding means you are welcoming baby home. You just imagine a guest coming in your home and you are not at all acknowledging. Usually it happens at first month of pregnancy because you even don't know. You come to know only when you are missing that period. But baby has entered much before that. So with these timings, you need to welcome baby. You need to make him feel comfortable. You need to make him wanted, him or her. So, baby bonding practices, gratitude, and small mindful walks, if medically permitted. So, this is what Yog Sadhana is for you during your first trimester. Now, when you are in second trimester, this is often called as golden trimester, and we at Womb Wisdom make a complete use of the second trimester because energy at this trimester usually improves under the guidance of qualified yoga masters. You can do many of the spectrum of asanas. So when you are inside the bloom flow, we take you to the guided yoga sadhana practices where according to your body, according to your like previous practices, we give you the sequence and the variety of yoga asanas to get performed. So but you need to have a guidance of a qualified prenatal yoga masters or instructors and with the approval of your treating obstetricians. So mothers may gradually include in this trimester gentle stretching, pelvic mobility, cat-cow movements, modified strengthening, hip opening practices, posture awareness, relaxation, and of course meditation, pranayam are added with a greater intensity at this time. Okay, so everything remains on comfort, not you are stretching your body so much. Now, when you are in third trimester, the goals changes. We prepare the body for birth. So the focus becomes posture, breath work, pelvic relaxation, endurance, confidence, birth prep, and deep relaxation. So these are the focus which we shift in your third trimester. Now the question arises that should I do yoga twice a week or how often should I do these practices? So imagine brushing your teeth twice a week. Would that work? Your nervous system needs regular care. So aim for some of the yoga sadhana every day. Even if only for 10 to 20 minutes, a balanced routine might include, for example, 5 to 10 minutes of gentle breathing and centering, 10 to 20 minutes of appropriate movement when medically cleared, and 5 to 10 minutes of relaxation or meditation. How simple is it? So, some days, especially when you are tired, simply doing breathing and relaxation is also enough, but that everyday consistency makes your nervous system more adaptable. It is not something that a chain of some tiring asanas you are doing every day. No, I'm not telling that. No one is going to tell you that. But a mixture, as I have told you, 5 to 10 minutes, 10 to 20, 5 to 10 minutes, gentle breathing, some appropriate yoga postures, relaxation. This is what is expected with you, my dears, during your pregnancy journey. So the greatest yoga practice is, out of all this, you are not able to do many of things. What you can do consistently is your breath work. So whenever you become anxious, your breath becomes short, right? डर लग रहा है कुछ है धड़कनें बढ़ जाती है सांस बढ़ जाती है सो व्हेन योर ब्रेथ बिकम्स स्लो योर ब्रेन रिसीव्स अ मैसेज आई एम सेफ सो the zest and I can say that yes you are doing yoga sadhana and it is getting applicable to you when I can say that when you are able to come to the breath work as soon as your body is giving the signals of some fear or some danger or you are in some panic. Okay, so slow breathing can help activate body's relaxation response and may reduce feeling of stress and anxiety. अब यहाँ पर बात आती है बहुत सारे मदर्स बोलते हैं कि हमारा आईवीएफ हुआ है आईयूआई हुआ है डॉक्टर ने हमें कंप्लीट बेड रेस्ट बोला है हमें स्टिचेस लिया है तो हम कैसे प्रैक्टिस करेंगे मैम ओके सो आई टेल देम देन for those mothers who are complete bed rest, then I will say that your yoga begins from your pillow. Understand it well. Bed rest doesn't mean giving up every aspect of yoga sadhana. There are practices which you can do even in the bed, lying down. Okay. Of course, your medical approval is important, my dear mothers. So, with medical approval, many mothers on bed rest can safely practice some of the things. For example, gentle diaphragmatic breathing, slow breathing into your lower ribs and abdomen without force. It is going to increase your lung capacity, calm down your nervous system, detoxify your body from free radical scavengers, and it is completely enough done. Because on bed rest, you are breathing, right? Breathing भी stop किया है क्या? नहीं. Okay. Other thing you can do is hand on heart, other hand on womb awareness, creating the moment of connection with themselves and the body. You can do it. You and your baby are always connected, but creating that awareness movement. You can do guided relaxation, releasing tension from head to toe, toe to head. You can do meditation. You can cultivate calm and emotional resilience. Positive affirmations, replacing fear. Because you know, when you are at bed rest, your body is at bed rest, but is your mind also? बेड रेस्ट अगर बोला है तो वो बॉडी और माइंड दोनों के लिए बोला है सो इफ बॉडी इज रेस्टिंग ऑन द बेड एंड माइंड इज जस्ट running with the fear, danger, and panic, believe me, you cannot say that your body is resting because the same chemical chemistry is created in body as well. So, positive affirmations, your vision board, your visualization, your gratitude practice, baby bonding like reading a book, talking, singing, praying, everything works and this also comes into yoga sadhana. So what yoga gives to your baby? You cannot promise a genius baby. You cannot say, "No, I'm doing yoga and I should have a genius baby." No. It cannot promise a painless birth. It cannot promise perfection. But what it can help cultivate? A calmer mother, a more connected pregnancy, greater awareness, better breathing, improved body awareness, more confidence, more peaceful journey. And that is the beautiful gift to your baby, to yourself, isn't it? Imagine a mother not doing any of these practices and is always hovering with the fear, guilt, doubt, frictions, and whatnot. And a mother who is practicing all these things, maybe both of them are IVF, both them are having the same medical situations. Tell me which mother would be able to connect more to the baby, would be able to transform herself, would be able to become a conscious mother. You can understand which, right? So every day ask yourself, today, did I nourish only my body or did I nourish my mind, my breath, my emotions, my baby? Because pregnancy is not only about growing a child, it is about growing a conscious mother, right? So every conscious breath is the first lesson your baby receives. I'm Dr. Preeti Trivedi, a sacred pregnancy architect. At Womb Wisdom, we don't even teach just yoga postures as exercise. We teach Yog Sadhana as a way of living through pregnancy, a practice that unites your breath, body, mind, emotions, relationships, and the sacred bond between mother and baby. Because when a mother transforms her inner world, my dear, she begins transforming the world her baby is about to enter. And that is the most important thing. So, dear mothers, don't wait even for a single day after listening to this, after understanding this for your yoga sadhana. Join to start your journey afresh and connection to the baby. Thank you. That is the gist of yoga sadhana. Now, tell me, if you have any of the question in this, if you have any of the queries, if you have any other thing to tell or share, you can share over here. That's what from my side when mothers are asking about yoga sadhana.